Welcome to Living Chronic, the podcast that explores the realities of living with chronic illness and disability while redefining how we thrive in our personal and professional lives. I'm your host, Brandy Schantz, a disabled veteran and chronic illness warrior, here to discuss the challenges, triumphs, and untapped potential of life with a chronic condition. Before we dive in, please take a minute to hit the subscribe button on whatever platform you're listening. Now, let's change the way we think about disability together. Hi, this is Brandy Schantz, and you're listening to Living Chronic. I'm here today with Suzy Burnett. She is Crony Mommy on Instagram, if you follow her. She is also a member of two of the clubs that I belong to, two clubs you probably don't want to join. She has Crohn's disease, and she also recently experienced drug-induced lupus. So, welcome, Suzy. Thank you for coming to Living Chronic.
Thank you, Brandy, and thank you for having me.
So you've had a blog and an Instagram account for a while chronicling your time with Crohn's disease, especially as a woman living with Crohn's disease and a mom. So tell me a little bit about your journey and why you decided to share.
Yes, absolutely. Well, I was diagnosed with Crohn's disease in 2008, although I feel I have had it since a young child. I was a picky eater, not because I didn't like the foods, but I noticed a reaction immediately when I ate different things. Started with frequent bathroom trips and was losing weight. But when I was younger, there just wasn't a lot of information out there on Crohn's disease and IBD. So it wasn't until 2008 that I was diagnosed, several years later when I was 28. And it took a few different doctors to finally get the diagnosis. And I still remember when the gastroenterologist, who's still currently my GI doctor, he told me I had Crohn's disease. And I turned to my mom and I said, "What's that?" I didn't even know what it was.
Yeah.
Fast forward a few years, I had been on balsalazide, which is a very mild medication that's commonly prescribed when you first get Crohn's or first diagnosed with Crohn's. And for a few years, I was just kind of in denial. I thought, I'm very active. Nothing is, that debilitating. I'm still able to function. I don't have this. I don't have this disease. And then the disease really hit and struck me. And I, like a lot of people with Crohn's, started having lots of blood in my stool, had a few hospitalizations. And then I knew, okay, this is real. I have this. It's not going away. There's no cure. I need to figure out how I'm going to accept this and move forward. And I've always enjoyed writing, but I found a new purpose through my writing. I realized that it was extremely therapeutic to write down my thoughts about what I was experiencing. And I had the idea to start a blog. And at the time I started it, it was more just to put my thoughts down. But what happened next was just such a beautiful, organic thing. I started connecting with people who had IBD all over the world, sharing their stories. And it was at that moment that I realized I had a new family, a group of people who are just like me, who had similar stories. And it was so comforting to me. So that really started my mission to not only help myself, but help others and advocate for the IBD community. And I have 3 kids, Lucy, Alice, and Guy. And so I really found that my experience with motherhood while having Crohn's was challenging, but
Mm-hmm.
I also had a lot to say, and other new moms could benefit from listening to my story, and hearing some of my struggles. There's a lot of misconceptions too about having Crohn's disease or UC,
Yes.
um, and thinking that you're not able to have kids. That's not true. Um, in fact, I was the healthiest I have ever been when I was pregnant with all three of my kiddos.
Yeah, right. I've heard that from quite a few Crohn's mommies.
Yes. So I do think there's a hormone component, possibly in there that,
Yes.
can help put us into remission. But yes, that is sort of in a nutshell why I started blogging. And it's just been such a wonderful experience for me. I've met so many people, including you, and it just really is wonderful for the IBD community just to come together from all walks of life, all over the world.
It really is. I've been amazed at how healing just putting your thoughts out there can be, and connecting with other people who share your challenges and your grief and, your struggles. I myself started the podcast just because, for me, I just didn't know how to get up in the morning anymore. Everything was so
Yeah,
difficult. And I thought, how do I stop crying? I don't know.
right.
And I said, well, let me just kind of talk through it and start a podcast. And like you meet people, you find out that you're helping others when you share your story,
Mhm,
which was a
mhm.
huge deal for me because I never, I was that kind of person who never wanted to show any kind of weakness or vulnerability.
Oh,
And here I was
likewise.
just spilling it all out.
Right.
Um, but the, both helping other people, the benefits to the community, and your own mental health, I think it makes a difference. Do you think that just being able to talk through it has helped you in times where maybe your mental health may have suffered as that mom with Crohn's disease, just being able to let it go and
Oh,
say, this is what I'm going through. Oh my goodness.
absolutely. Yes, you bring up such an important point because although my family has, excuse me, a strong understanding of what IBD is and what we go through, they can't fully understand it.
No.
So to have that separate community to reach out to, when you're flaring, when you have those days when you don't want to get out of bed,
Yeah.
um, new symptoms, any questions that you might have that you haven't experienced this. It's so helpful to talk to somebody who has gone through something similar.
Hmm.
I know when I was first diagnosed, it was hard to find other people who had IBD.
Yes.
And now, it's amazing how many people do in fact suffer from IBD, but all the advocates there are out there. And I think how lucky those newly diagnosed people are because there's so many resources now. And I feel so grateful and that we're able to help all these people.
And it gets better every day thanks to people like you. And, when you stand up and you say, hey, we need help, people pay attention. But if you don't stand up, nobody's going to count you in.
No, no. And, I often joke I'm the most annoying patient, but the
Hmm.
squeaky mouse does get the cheese because if
It really
you
does.
remain silent, you will not be heard. And you just have to stand up for yourself. You have to, or you will become just a number in a pile of cases.
Yes.
And
And
that's
of course,
unacceptable.
as any chronic illness patient knows, no matter what your diagnosis is, we have a shortage of medical professionals. Doctors are overworked.
Hmm. Hmm.
There's no clear communication system going out to doctors saying, hey, this is on the rise. Be on the lookout for this, or,
Right.
this is happening in this drug set, make sure you can understand. So when I was starting this podcast and learning so much from each person that came on, one of my guests said, nobody's coming to save you. You've got to save yourself.
Oh, so
And I
true.
thought, isn't that the truth? Isn't that the truth? So when we're out here and we're talking and we're standing up and we're saying, hey, let's pay attention, that is the only way we're going to get the medical community, healthcare, pharmaceuticals, to really do something and, say, hey, we've got to do better. We need to give
Right.
patients better care. We need to pay
Yes,
attention more. And I think, it's that sharing that helps with the diagnosis as well.
absolutely.
Because
Absolutely.
you have to push your doctor along a little bit. And we
Do.
talked about that in regards to drug-induced lupus. You were
Right.
diagnosed much quicker than I was. So you got 2 months. But 2 months when you're suffering from drug-induced lupus, anybody who's gone through this knows it's painful. It is debilitating. You lose your life so quickly,
You do.
so quickly.
You do.
And you had to go in and really push yourself just to get the drug-induced lupus diagnosis.
I did. And in retrospect, it's sort of unbelievable because
Mm-hmm.
and Brandy, I can't believe you went 19 months without a diagnosis and
Mm-hmm.
fighting so hard for your right. I mean, as a
Yeah.
patient, it's our right to be heard, and to have to struggle so much just to be heard is
Mm-hmm.
very frustrating. And in my experience, I'm very fortunate. I have a wonderful GI doctor. In fact, he's been with me since the beginning, so almost 18 years now. And he was well aware of sort of, I guess we'll say, my issues with my primary care doctor.
Mm-hmm.
Um, I when I initially had some symptoms, which for me mostly was the rash on my face, and the debilitating joint pain, just feeling like I
Mm-hmm.
could not get out of bed, my elbows, my knees locking, and we discussed earlier just not being able to go out for a run. And that is my most favorite thing to do.
Mm-hmm.
And for me to not be able to get out there and pound the pavement, something is very, very wrong.
Yes.
So I had told my PCP all of this, and she just said, okay, well, we'll watch you for a few months. So I went to my GI doctor
Mm-hmm.
and I said, all right, can we do I always order my own labs because,
Mm-hmm.
or I tell him, okay, it's time. I'm feeling a little funny. We gotta place some orders. So I told him what was going on, and he ordered a CBC panel
Mm-hmm.
first. And so that came back just a little bit more abnormal. I actually, with my Crohn's, my CBC is also always within normal range and healthy. It's the calprotectin stool test that will come
Mm-hmm.
back
Yep.
extremely elevated if
Same.
there's any inflammation in our bodies, right? So a few of those markers on my CBC were abnormal. He was able to write a note to my PCP and say, hey, these are not, these numbers are not related to Crohn's. We
Right.
need to dig further. So, I had brought up the fact that it's rare, or they told us it's rare,
They say
but
so.
right, Humira can cause drug-induced lupus. So I am feeling some, how I go down kind of the Google rabbit hole sometimes, and I shouldn't. But everything I was typing in came up as drug-induced lupus, everything that I was
Yeah.
experiencing, my symptoms. So long story short, my PCP finally listened, sort of, ordered a few more tests, specifically the ANA test, which
Mm-hmm.
does tests for lupus. Um, and other autoimmune diseases. So it came back negative for Wilson's, Sjogren syndrome, and it came back positive for lupus. And also my C3 and C4 levels, everyone has those in their bodies. Mine were off the charts, low for one and high for the other.
Mm-hmm.
So all of this together was indicative of drug-induced lupus.
Yep.
But a rheumatologist has to be the one that can officially diagnose you. So I did get that referral. And even this doctor was not fully listening to me.
No.
But and spent maybe all of 10 minutes with me in his office. You know, it was clear he had better things to do, but he did officially diagnose me with drug-induced lupus. And it is reversible, but I'm still feeling some of those effects because I came off Humira February 14th. Happy Valentine's Day to me. And it's still taking a little bit for it to fully get out of my system. I definitely.
It took 6 months to get out of mine, which was a long 6 months. But what's interesting is many people who suffer drug-induced lupus never test positive for lupus. So the ANA is not always positive when you're going through this.
You're right.
And I've learned over time, well, number one, when I started doing a lot of reading on my own, because again, nobody's coming to save us. That's for darn sure.
No.
So I started combing through NIH medical journal articles myself and found a study that indicated that as many as 30% of patients who take Humira can have this reaction. And of course, after joining the Crohn's Colitis Foundation board, I realized, when you say my joints are stiff, I can't really move. The people who know,
Yes.
And they say, that's your Humira. And of course, I also learned the hard way that neurologists are actually pretty familiar with this.
Yeah.
And when I explain what I'm going through to a neurologist, they're like, that's the Humira, you have to come off. So it's a little concerning that neurologists know our GI meds better than our GI docs.
It is.
Truth be told, these neurologic effects that come with them often, you may go to your GI and the GI says, I don't know what's going on with you. And then you go see a neurologist and they kind of get all of us in a big pot coming in saying, why am I suddenly named the neurologic condition that you're, experiencing right now? Or why suddenly can my arms not move? And they're like, it's the Humira again. So they know. Unfortunately, it's just not well communicated. And I love that I see you on Instagram and you're putting out the good information. You're saying, hey, this is drug-induced lupus. Let's talk about what happens. Let's talk about what this feels like. I told you this morning, I spoke with a woman on Facebook last night who has Crohn's disease, is on same drugs we were, and said, oh my gosh, my joints are so stiff. I'm in pain. I can't move. And I said, no, go to the ER.
Yes.
Bring them this information. And sure enough, she's also going through drug-induced lupus. So we got to just keep saying it.
You're right, Brandy, because we're told it's incredibly rare. And you and we are finding out that it is not rare. And, when I first was diagnosed with drug-induced lupus and wrote the few posts sort of explaining my journey, I couldn't believe how many people reached out saying, oh my goodness, do you think I have lupus too? I'm having this rash. My joints are buckling. I can't move. I'm so stiff. And sure enough, more people are being diagnosed.
Yeah.
Or at least, on high alert for something that is other than Crohn's, because that's the hard part, because you and I discussed that Crohn's symptoms can mimic other autoimmune diseases, right? Or we often have more than
they pair
one.
up.
Yes. So it makes our job extra tricky because we have to just keep pushing and talk to the right people.
Yes.
If we don't have a specific doctor of specialty in our corner, it is incredibly hard.
It really is, because you have to have an advocate.
You do?
So often you're just a number, you're the next patient. Get
Yes.
out of here. I've got another patient in 5 minutes. And, they're just not putting in the work we are.
No.
I sat at home reading through NIH medical journal articles like it was fun. It's not. And found all sorts of stuff that I never wanted to know.
Right.
But doctors, they don't have time to do this. And when they get
No.
home after a long day, they're not saying, I should really be doing some reading to see what's new on the horizon. Most of them just
Right.
go home, take care of the kids, do their own thing, whatever their hobby is, whatever they want to do with their free time.
Yes.
And, nobody has made it easy for these docs to see these kind of trends, to say,
Mm.
look at all these people on Humira. And it's not just Humira, there's other drugs
Yes. Yes. With
coming
a
down with
long
drug-induced
list of
lupus.
side effects. I mean, we've all seen the commercials um, with the long.
They speed through that and they never mention the reality of it. I
No.
always joke with my friends, my fellow cronies, that I wish they would let us make a commercial.
I know,
Because
right?
it wouldn't be some cutesy, oh, look, there's a bathroom. Maybe I have to go. No, it's going to be reality. It's going to
Yes.
be, I
We'll
can't
be
move.
sprinting to the
There's
bathroom,
blood.
possibly having an accident along the way. I mean,
Screaming for your husband, the guy who used to
right,
think you were sexy at one point, and now you're like,
right.
babe, I think I got to go to the ER, and he's trying to clean you up and get you out the door so you don't
Right.
die on your bathroom floor. No, yeah,
Right.
give me something realistic.
I know.
And
Those little
speeding through drug induced
stores.
lupus doesn't help. Let's
No.
put somebody out there that can't move, can't
Right.
lift their arms above their head because,
Please.
hey, that's drug induced lupus.
That is the reality. That's reality. And
Yeah.
Brandy, it's what I end up feeling so bad for are the patients who don't advocate for themselves or
Hmm.
can't because,
Yeah.
oftentimes when a professional tells you something, you're going to believe them, right?
Yep.
And take them at their word. But we've learned that's not necessarily the case. And sometimes we've had to learn the hard way. And that can be uncomfortable, speaking up
It
for
can.
yourself. So, I truly wish that for those patients who aren't comfortable or for whatever reason have a harder time speaking up, I wish everyone was assigned a patient
An
advocate,
advocate.
a buddy to go
Yep.
with them and fight
That's
for
what you
them
need.
because we are proof that we've had to do our own research and get the answers we need to seek the treatment that we need and deserve because that is our right as a patient.
Absolutely. And you know what? I say it all the time. I'm kind of a pushy broad, anyways. I'm going to stand up.
I
I'm
love
going
it.
to tell you what I need to have done. I'm
Yep.
going to do a lot of research. I'm not a doctor. I'm not science adjacent, but I'm very well educated. You have a
Yes.
graduate degree. You know how to do some rigorous research.
Yes.
So, I have a lot of qualities to push that through. But you know what? A world full of nothing but people like me, what a nightmare. What a nightmare. We can't tell everybody to be like that. And thank goodness we need all kinds. And yeah, it is unfortunate that, people who may not want to be so pushy or feel bad, they just don't have that same somebody there to say, hey, you know what? We need to do these tests or
Yes.
we need to get this referral. And I think one of my biggest complaints in a list of many complaints about our healthcare system is doctors enjoy a position that nobody else does. I always say, imagine if your financial planner said, well, I think this is the best investment for you right now. So this is what we're going to do. We're putting all your money in here. And they just don't give you a choice. And if you push back, they say, well, this is what I think is the best, and I'm the professional. If you want a different opinion, find a different financial professional.
Right.
Imagine they would never do that. And, we could plug that in for any professional. We would be fired. If I ever, gave a boss just one option and said, well, I think it's the best, so this is what we're doing, and never discussed a full range of options, what various experts think, what could happen, I would just be fired. My boss would be like, okay, well, no, we don't do work like this. But
Right.
doctors do it
Oh,
every day, and
yes.
get away with it.
Yep.
Nobody says, hey, no, these patients didn't wait 6 months to get your opinion. They waited 6 months for you to look at all of the evidence, to, run a battery of tests, and then discuss with them all the science that's
Yeah.
available and all the possibilities, and then all their options. Maybe I don't want to take the meds you want me to take.
Right. Right.
Give me a list and let me do some reading. Maybe tell me your opinion, a little bit. Well, I think this one's best and this is why, but this one also, blah, blah, blah. But the fact that so often we go into the doctor and all we get is, well, I think it's this, so that's it. Did I
Right.
just pay you for that?
Right. Right. Well, and to just be sort of passed on like
Yeah.
nothing is wrong. I mean, my PCP was just going to sit and wait and watch me.
Yeah. As if you don't have a life to live right now. The kids are not waiting for this, doc.
No, no. I mean, I have to be healthy and functioning to not only take care of myself, but my kids and my husband. And it's very frustrating and sad that we have to deal with all of the red tape and the health care policies when it doesn't have to be that easy, that hard. I
Yeah.
mean, in fact, with my recent, I had to go through the PA process again just to get on Entyvio, and it
Mm-hmm.
was a nightmare.
Yep.
And patients shouldn't have to go through that every time
No.
there's a medication change, or within the drugs, there's often different ways to administer it. I wasn't approved for um, administering my own injections because that was too
Mm.
expensive. So
Oh,
I,
wow.
I was
Yeah.
forced to do the infusions, which is fine because I want to be treated, but
Right.
I would prefer to do the injection in the comfort of my own home. So it's all these unnecessary hoops we have to jump through.
Absolutely. Well, they never take into account, and I love, kind of dipping my toes into things that I understand a little bit more. When you take a look at the entirety of, your health and your productivity and, time and, all these various aspects, it's so much better for the economy at large to just make sure I get what I need immediately
Right, right.
and send me on my way. It
Yes,
doesn't help anybody when I have to take 6 hours off of work to get an infusion. It doesn't help anybody when I have to wait it out 3 months for the next medication because we want to do a step therapy. You're losing productivity in the economy. You're, you know, potentially pulling away from somebody else. The kids, how are they getting to school? Like, I have a whole life here. What do you want me to do? You want me to not go to work, not mom the kids, not, go to the second job for people who are working second jobs, or go to school. There's so many factors. And I know that healthcare is just not looking at all of them, because if they were, they would probably say, you know what? We'd end up saving money in the long run if we weren't going through all these ridiculous hoops.
right. I mean, it's just ridiculous. And as
Hmm.
patients, we need to be able to take the medication that our doctor first prescribed.
Yes.
There,
And the one that we feel most comfortable with as
and what
well.
one we feel the most comfortable with. Yes. I mean, it doesn't make sense. It never has to me that we have to jump through all these hoops, but it is what it is. And I think we're doing everything we can to advocate for ourselves as well as the entire IBD community, because
Yes.
we all have different stories, but collectively we can learn from each other, and hopefully we won't have these struggles, in the near
Yes.
future. Because I
Well,
think you
together
and
we
I
speak
are
with one loud
similar.
voice.
Yes, you and I are a similar age. So we've been battling this for a long time, you know. We're ready
Yes.
for things to maybe be just a little bit easier.
Yes. Make it better for us, please.
Right.
And, and thank goodness for places like Crohn's Colitis Foundation, because they are doing
They do
the
so much.
studies that other people aren't. They're looking at the safety of these drugs long term. They're looking at, the prevalence of a lot of these reactions. They're taking a look at how they can help us to, get our meds the first time. Get rid, they're pushing the Step Act, stop this nonsense. Give us the
Yes.
meds we need immediately. Get us back out there and contributing to the economy, doing all sorts of good things. So thank goodness for them too. And thank goodness for what you're putting out, for everybody who's not following you on Instagram. It's Crony Mommy. Your blog is in the bio, and you're really doing great work out there, helping people understand what is drug-induced lupus and what is it like to be a mom and, dealing with Crohn's disease, because those are two things that so many people need to understand.
Yes. Well, if I can help at least one person, honestly, that makes it worth it. You know,
No,
I mean,
absolutely.
it's such a community that we have. It's a very special community, the IBD community, and it's just so wonderful to be a part of it. So, just
Yeah.
thank
Well,
you.
thank you so much for coming on, and hopefully we can, have you back, and maybe we can talk about life after drug-induced lupus. I know it takes a little while to get it out of your system and
Yes,
shake it out
still
and
not
jump back into life.
100% yet, but I'll get there.
Yeah. All right. Thank you for
All right.
coming to Living Chronic, and hopefully every day is getting a little bit better for you.
Yes. Thank you, Brandy. Take care.
That's a wrap for this episode of Living Chronic. I hope today's conversation gave you insight, inspiration, or at least a little reassurance that you're not alone on this journey. Living with a chronic illness or disability comes with its challenges, but it also comes with strength, resilience, and a community that understands. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who might need to hear it. You could follow me on Instagram at Chronically Brandy Schantz, other socials at Brandy Schantz, or my website at brandyschantz.com for more discussions, advocacy updates, and everyday strategies for thriving with a chronic illness. And if you have a topic you'd like to hear about, send me a message. I'd love to hear from you. Until next time, keep pushing forward, keep advocating for yourself, and remember, you are more than your diagnosis. You are powerful, you are unstoppable. Thanks for listening to Living Chronic. See you next time.